You've got ideas, you've got ambition, you've got no time, or so you think. I'm Marissa Lonick, and I help busy moms with big dreams and no time. Join me each week as I dive into time management strategies, goal setting and achieving framework, and inspiring guests who are juggling mom life, work life, fill in the blank life. Dreams don't work unless you do, and just because you're a mom doesn't mean you can't still make it happen, whatever it means to you. Welcome to the Mama Work It podcast. Hey, mama friends. Welcome back to another amazing episode of the Mama Work It podcast. I am so excited today. We have Dr. Carolina Sueldo, Fertility Specialist, double board certified OBGYN and REI. Ooh, she's going to be able to tell us so much good stuff on today's episode. Dr. Carolina is a mom of 2 kiddos, 3 years and 9 months, and she is here today to talk to us all about postpartum health, particularly related to our hormones. So we're going to be diving into what's normal, what's not, when to seek support, when to take a deep breath and not drive yourself crazy on WebMD. We're getting into all of it. Dr. Carolina, thank you so much for being here.
Yeah, Marissa, thank you so much for having me. This is awesome. And as, not only as a physician, but as a mom to two littles, it definitely hits home for me. And definitely, I wish I would have had, more knowledge and more education, even as an OBGYN, even as a fertility specialist. So this is particularly exciting for me to be here today.
Amazing. Well, good. I know I'm going to learn a lot. I'm sure our listeners are too. So let's dive into this. First things first, why don't you just tell us a little bit more about you, how you got started on your journey as a physician, as a mom, and now as a hormone expert for women?
Yeah. So the career is not super sophisticated in terms of how I got there. I knew I wanted to help people, and I knew I didn't want a desk job. And my parents were like, go for the highest degree. And that was that was pretty much how that was decided. And then as I was going through my clinicals, I really, really enjoyed the women's health piece. And I think, identifying as somebody, I was in my 20s at that point, a lot of friends who were not in medicine asking me, I was sort of the resident physician for all of them. And so asking me all these questions that to me seemed super basic or super 101, everyone should know. And I realized that a lot of these women, my friends, super educated women, but really had no clue about what was normal and what wasn't. So that really sort of drove my passion to join OBGYN and then pursue the fertility piece, the hormone piece. And I always tell my medical students, if you can understand the menstrual cycle, you can understand 95% of what I do as a physician. So it's really my mission, to empower women. If they can understand their bodies and understand the menstrual cycle, then they can understand when that's not normal and when they should see a physician.
It's that simple, huh? Just know how the menstrual cycle works.
Exactly. It really is that simple. If you know that, the cat's out of the bag. It's about 90% of what I do.
All right. Amazing. I'm sure it's more than that, but that's good to know. It's not as intimidating as I thought. Okay. So let's dive into postpartum hormones. I think I can confidently say all moms, including myself, experience a plethora of emotions after giving birth, right? For the first few days, maybe even weeks. So when would you say is the red flag though? Either on time elapsed or intensity of those feelings? When should you be consulting your physician that maybe this isn't just baby blues? Maybe this is actually something more serious, like postpartum depression, postpartum anxiety, something that really needs treatment.
Sure. Yeah, this question definitely hits home for me. As a new mom, as a physician, was definitely struggling and trying to figure out, when to reach out and I don't want to be the patient that's bothering the doctor, but at the same time, I want to make sure I'm taking care of myself. And to be honest with you, with my firstborn, I probably should have sought care out sooner than I did. And I think that was me trying to put on a brave face, and motherhood is supposed to be this amazing journey and wonderful and, rainbows and butterflies. And it really wasn't. It was really, really tough for me that first go around. And it to the point where I had some PTSD going into the second. But thankfully, was now sort of more educated and empowered, and definitely sought out care much sooner. But I think, where I'll start, I'm actually going to rewind to pre-delivery and talk about when we're pregnant, there are so many hormones that are being impacted. There's so many hormonal changes. And we know that estrogen in particular is a feel-good hormone. So a lot of women will talk about being pregnant. It's the best they've ever felt. It's the most energy they've ever felt. They talk about this pregnancy glow. It's basically like all your hormones are on steroids. So everything is sort of heightened and exaggerated and whatnot. And the main producer of those hormones is the placenta. And so what happens at time of delivery is after the baby, you deliver the placenta, and there's this immediate just dive of these hormones. And they really, really drop really significantly, and they drop really fast. So it's actually super, super common for those first 2 weeks postpartum to definitely have some feelings of what we call now, or the common term is baby blues, where you're feeling like, maybe you're feeling like you're not as happy as you should feel, or you're not as glowy as you were. Clearly you're exhausted because nobody's sleeping. So that doesn't help either. So there's such a radical change that happens in such a short period. And really the idea is so there's a couple different definitions, and one of them is really focused on timing. So in the first 2 weeks, those feelings can be very normal. Being emotional, being teary, those things are okay. Well, I shouldn't say okay, but they are considered part of this baby blues type of thing. Once it extends beyond 2 weeks, then you really want to start thinking about and maybe registering, are these symptoms normal? Am I sort of, crying in the corners or very emotional? Am I having difficulty sleeping beyond what can be considered for a new mom? Am I having problems attaching with the baby? And I think that is a huge trigger for most physicians. If the mom is, and I say this jokingly, but everyone thinks you're immediately going to have this attachment to your baby. And that doesn't happen for every mother. It's definitely something that develops and grows as time passes. But if you're beyond that 2 week time frame and you're really struggling with attachment, struggling to have reactions or emotion to baby's cry or baby's feed, then it's definitely time to sort of bring those to light. Now, that said, there's nothing magical about 2 weeks. So if in those first 2 weeks, you're feeling really down, you're having maybe trouble with appetite, you really are having emotional, serious emotional concerns, issues with your partner, et cetera, those are all things that would warrant earlier seeking out help or much earlier. So I don't want people to say, oh, I have to wait out these 2 weeks, like something magical is going to happen at the 2 week mark. If you are having concerns enough so that it is interfering with your ability to progress in a normal fashion with the postpartum period, then you definitely should be talking to your physician, because there's a lot of medications now that are safe to take while breastfeeding. There's therapy that can be complementary to that can help. I mean, there's so many things, for example, for me, I know breastfeeding was a huge trigger. I had a really, really tough time breastfeeding. So working with a lactation consultant who is supportive, who understands, who's not going to pressure you. I mean, there's so many components. I really do talk about a multidisciplinary approach when you're looking at that fourth trimester.
Yeah, I had no idea about that plummet of hormones. Thank you so much for
Yeah.
educating us on that. And don't you agree with me that there is like not enough education, support, just not enough women talking about the breastfeeding journey? Like that was one of the hardest parts of motherhood for me too. And I feel like nobody talks about it. And it's like, it can be a trigger. It can be really, really trying on your emotional, mental health during that time. Oh, so challenging.
Absolutely. And, I think there's sort of two sides to it. From the physician side, as OBGYNs, and I speak as one, we really don't get training in what's normal postpartum. We get trained in disease. We get trained in how to take care of the sick patient postpartum, the infection, the, blood clot, whatever sort of disease state you can think of. But we really don't get proper training in normal fourth trimester evolution. And I would add that we really don't see the patient enough. I mean, think about how often you're seeing your OB during pregnancy. Like towards the end, you're in there every week. And then all of a sudden you have 1 2-week visit and 1 6-week visit, and then good luck. And that's not nearly enough. We know that that fourth trimester is so important. Those hormone changes we were talking about, that breastfeeding journey that we're talking about, so many different things. And when they say it takes a village, it really takes a village. And so really, I think on the physician side, educating providers about that fourth trimester. And I think, frankly, from an insurance piece, really advocating for more visits to be included so that the patient can get more routine, regular FaceTime with her physician. Now, on the patient side, I think that we, especially now in the era of social media, are sort of sold this idea of what the postpartum journey should look like and what that fourth trimester should be. And then there's reality, right? And there are some women out there, showing the realness of it. And I appreciate that, but I would say there's not nearly enough of that. And so as women, we really need to come together and really talk about it. And speaking for myself, I know once I brought it to light in a group of, there's probably 15 of us in my first time mom group, and at least a third of us, if not more, had different struggles that nobody was talking about in our group. So I think once I sort of opened the lid, then everybody felt comfortable sharing their different experiences. Because for some, not everybody's breastfeeding, right? So for some, it's the sleep issue. For some, it's colic. For some, it's, issues with the partner and how much workload, who's doing what. So everyone's going through a little bit of a different journey. But being able to share those stories and not just the highlight reel, I think is very important.
I couldn't agree more. I think those mom groups, I was in one when I had twins first, and then I was in one when I had my second baby, or my third baby, sorry, because we had moved, and it was a great opportunity to make some new friends. And even though I was like a quote unquote veteran mom by that point, I feel like every time you relearn everything.
Yep.
But
Oh yeah.
they're such amazing environments, as you said, for someone to just open up the can of worms and everyone to just have a safe space to talk about those things that no one's talking about, that you don't see on the highlight reels, that you don't see out there. So I totally agree. If you're listening, if you're a first time mom, third time mom, fifth time mom, get into one of those groups no matter what, because it is so important. So important. So to piggyback on breastfeeding a little bit, let's say you have a baby, you've done breastfeeding, or you stopped breastfeeding, or maybe you never even started breastfeeding. But your period hasn't come back to normal. Like, what's normal with regards to that?
Yeah, so that's a great question. And the idea is to start with the concept of what's normal. And a healthy reproductive age woman really should be having normal monthly predictable bleeds. So, if you're getting them 28 to 30 days or 32 to 35, there can be a few day variation. It doesn't have to be exactly on the nose, but you should be getting a predictable monthly bleed. Now, there are some factors that play into that. You mentioned breastfeeding, how close to delivery you are or not, et cetera. So there are some factors that play into that. But by and large, once you return to quote unquote baseline, if you were having normal cycles previously, you should return to that. So if you're now going longer than 35 days, or shorter than 21 days. So think of 28, which is what all the textbooks and images, graphs show us, plus minus 1 week. So 21 to 35, that's what's considered normal. And if you're outside of that range over a period of 2 to 3 to 4 months, then you definitely want to be seeking out the support of a OBGYN physician or a fertility physician, because now, an evaluation of those irregular cycles will be warranted.
Interesting. Okay. So what I'm hearing you say is either postpartum or post-weaning, if you haven't returned to a quote unquote normal stage between 21 and 35 days within, did you say 4 months or so?
Yeah. So once you wean, so once you stop breastfeeding, eventually let me backtrack. So the main driver of breastfeeding is prolactin. And that prolactin hormone can interfere in the communication between the brain and the ovary for a normal ovulatory cycle. So you may or may not have ovulation while breastfeeding. It varies patient to patient. And that's why contraception is so important to talk about, because not everyone, a lot of people think, oh, I'll just breastfeed and I can't get pregnant. No, that's not true. But going back to the breastfeeding, assuming that you have weaned, assuming that prolactin hormone is back to normal, you really should be getting your normal baseline monthly periods. So if you notice, okay, I stopped breastfeeding, things theoretically should be back to normal, and I've now gone 6 months and I've maybe had 2 periods, that's definitely not normal. So, the first cycle, everyone can adjust a little bit, take a little bit longer or shorter to get back into the swing of things. But really over the course of 3 to 4 months, you should be able to sort of see a pattern or a tracking of what things are going to look like.
Got it. Makes sense. Okay. So I've seen this next question a lot on mom groups and social media, usually asked anonymously because it's quite
Okay.
personal, but it
Okay.
feels necessary to ask here since we have your expertise and we want to provide all that good and useful information to our listeners. So what if you're getting back in the groove with your partner after you've healed and are maybe getting a little more sleep, but now sex feels painful? Is that normal?
Awesome. So easy answer to that question is sex should never feel painful. Sex should never hurt. Okay. Now, the reason for the sex being painful can be a normal variation or an abnormal variation. So when you think about a normal variation, when you have that drop in estrogen, that plummeting of the hormone that I was mentioning, there may be difficulty in lubrication, even with stimulation. The other scenario could be if you're actively breastfeeding. Again, we talk about that prolactin hormone, that breastfeeding hormone interfering with the normal production of estrogen. So similarly is going to impact lubrication in the vaginal region. So theoretically, if the issue is with penetration or during intercourse and a lubricant is easily solving that problem, then it's probably related to something, hormonal with the vaginal dryness. But if you've tried the lubricant or if sex is painful, particularly with deep thrusting, that's definitely not normal. So there are many different things that could potentially cause that. One could be, something as easy as maybe the patient has some sort of infection that needs to be explored. That's definitely something I would, consider. But then the other one would be underlying diseases that have now popped up post-delivery, whether that is fibroids of the uterus, whether that is a disease called endometriosis. So there are any number of things that need to be explored, but definitely painful sex is not normal.
Yeah. I just side note here, Dr. Carolina, I'm sure you're in like the social media mom groups, right? You're a mom, you've got young kids. Do you cringe when you see all these questions pop up, like of moms asking other moms instead of them just like picking up the phone and contacting their doctor?
Yes. And honestly, Marissa, that's a huge part of why I'm here today. That's a huge part of why I decided to join the social spaces, is because both as a mom and as a physician, my patients were coming to me, oh, well, in this group, somebody said, or, I was researching and this, one patient said X, Y, or Z. And I realized that, physicians, of course, we want to be scientific, we want to be academicians, but we need to be in all these spaces because patients are going there for their health information. I want to make sure that they're getting accurate information. So, I will say it makes me cringe a little bit, but I also think it's partially on the healthcare system or on the physicians to really improve our education of those patients so that they're not having to go and ask in those places.
Right, right. Well, every doctor should be like you. That's awesome.
Thank you.
So I feel really fortunate. My husband and I, we never experienced fertility issues, but I know so many women do. And the interesting thing I often notice, though, is that it's not the case for every pregnancy, right? Like if you've been trying maybe for baby number 2 for some time now and it's not happening, but your first baby came like not even asking for the baby, right?
No
Like just,
problem. Yep.
yeah. So can a woman have infertility even if she's had a child before? Like, how is that caused? Where's the hormonal imbalance? What should she do if she's
Yeah.
experiencing this? Loaded question, I know, but I'm curious.
No, this is great. I actually see this a lot more common than people think. And it's extremely frustrating for the couple, right? Because like you said, maybe they were on birth control or had just gotten off of birth control and got pregnant right away, no problem. And here they are, 9, 12, 18 months later, and nothing's happening. And so they're extremely frustrated. They don't understand what's going on, and they want answers. And so what I typically will tell patients is the time to seek out a fertility specialist would be, number one, age-based. So if the woman is under the age of 35 and they've been trying for over a year, or if the woman is over the age of 35, they've been trying for over 6 months. But I would argue that there are other criteria to seek out help sooner. So again, we come back to the irregular cycles, the super painful periods or super painful intercourse, or if there was a history of infertility in the past, you definitely want to make sure you're not waiting too long. So there are a couple qualifiers to my answer. Or if there were significant changes from the pregnancy and delivery, let's say, the pregnancy was complicated or the delivery was complicated, or somebody now has a new diagnosis of diabetes, et cetera. So anyway, what I'm trying to say is, yes, age and time is the most commonly used thing, but there are other things that also factor into that. When you talk about an evaluation, there's really 5 components to that evaluation. And on the female side, what we're trying to assess is, the ovaries and the egg reserve, the uterus and the uterine cavity, which is where the embryo implants, the fallopian tubes, are they still open or are they now closed? We don't want to forget the guys, because we know that male factor infertility contributes to 30% at least. So we want to make sure we're getting a semen analysis if there's a male partner involved. And what's interesting about all of this is that 20% of the time, the workup comes back normal.
Wow.
So 1 out of 5 couples that I see has a diagnosis of unexplained infertility, which is not actually unexplained. It's just the testing available today is not finding whatever it is that's going on. So 20% of couples that I see, so 1 out of 5 will have a negative workup. And so now they're even more frustrated because now they've gone through the testing and they don't have answers. But we absolutely see this. And I think, I don't think people realize it happens a lot more commonly than most people talk about. But it is important to seek out help, because we do know that pregnancy rates go down the longer that you try. So even a healthy, normal, fertile female, after a year of trying, we see that pregnancy rates go down to under 5%. And so that fertility evaluation that I mentioned, and potentially fertility treatments in the future, would be indicated.
Interesting. Okay. I'm sure that's super, super helpful for our listeners to hear. So we mentioned earlier in the episode, understanding the menstrual cycle is like 90% of this. Give us a quick and dirty lesson on this so we can all have a really good takeaway from today's episode.
Yeah, absolutely. Absolutely. So there's a few things, but I want to start with first that as women, we are born with all the eggs we're going to have in our lifetime. And we lose those eggs progressively and continually as we age. So women need to understand the concept of ovarian aging. They need to understand that both egg quantity and egg quality remain fairly stable until about age 35. And then after age 35, we do see a very real decline in fertility. So for example, if I have a patient who's had, 3 prior children, but the last pregnancy was 8 years ago and she's now 39, well, age-based risk alone is going to increase the likelihood of infertility for that patient. So that's really important. The concept of ovarian aging is super, super important. So I do want to impress upon your audience that concept. Now, when you talk about the menstrual cycle, in a patient who is having regular monthly periods, essentially what's happening is during your menses, there is a group of recruits in the ovary. So a cohort of eggs that's just waiting there for the brain hormones to come and recruit somebody. And so of that group, one gets recruited to be the dominant follicle, the others die off and reabsorb. And as that dominant follicle grows, it produces that hormone of estrogen. So Estrogen increases slowly but steadily throughout that first half of the menstrual cycle until eventually it triggers the hormone of ovulation called LH, or the luteinizing hormone. And so that hormone of ovulation causes the follicle to rupture. So causes the sac to release the egg into the pelvis that's then picked up by the fallopian tube. And then potentially, if there's sperm present at the time of ovulation, potentially fertilized by sperm. The sac from where the egg was released is now called the corpus luteum. So the corpus luteum makes two dominant hormones, estrogen and progesterone. Progesterone is the primary hormone of that second half of the cycle. And that corpus luteum hangs out in the body for about 2 weeks. So at the end of those 2 weeks, if there's no pregnancy around to keep it stimulated, the corpus luteum goes away. Because of that, estrogen and progesterone fall. Because of that, our lining sheds. We get a period, and the next group comes up for the next round. So that's, in a nutshell, under 1 minute, I think I got it, would be the menstrual cycle. And I think if there's like two takeaways, is that estrogen in increasing steady fashion is the primary hormone of the first half of the cycle. Progesterone in a steady state is the dominant hormone of the second half of the cycle. So I have a lot of patients who will come and say, well, my estrogen is, high, or my progesterone's low, or variations, or they're taking progesterone the whole month or whatnot. That is not going to increase your fertility. In fact, taking progesterone every day is a method of birth control. So you really want to make sure that before you start taking hormones, that you're working with a physician, whether it's your OBGYN or a hormone specialist like myself, to make sure that you're addressing it properly.
Okay. Schedule the MCATs for me. I'm ready.
I'm telling you, if you
that was a great explanation.
If you can understand that, that egg growing, that rupture, and then progesterone for 2 weeks, that's pretty much it. You're set.
Well, I'm sure there's a lot more, but thank you for that explanation. That made perfect sense. And I think, something that simple that we should probably all have a pretty good grasp on, and we really don't, right? We're not educated in that on a regular basis. So thanks for letting us know. All right, Dr. Carolina, we're going to move on now to our lightning round, where we're going to ask you just some random, just for fun type questions, just so our listeners can get to know you a little bit more personally.
Okay.
Are you ready?
I am ready. I'll say whatever comes top of mind.
Yeah, just go with your gut.
Okay.
What is one app you cannot live without?
Ooh, right now, unfortunately, I hate to admit it, but my guilty pleasure is Instagram.
Believe it or not, it is a popular choice on the show.
Okay. That makes me feel slightly less guilty about it.
Yeah. What is your guilty pleasure TV show?
Real Housewives, all day, every day. Specifically, Real Housewives of Atlanta, which is terrible, but the truth.
We just speak the truth here. We keep it real. It's okay. All right. What is your go-to, get it done song?
So I am a lover of all things J-Lo. So definitely putting on a J-Lo remixer is my go-to.
Yes. Okay. Side note, did you see the documentary?
Yes, I did, and loved it and cried. So yes, I know. I love her.
Same.
Yeah.
Same.
Love. She has defied so many things in her career. I think she's awesome.
Yeah, I agree. All right. Would you call yourself more of an introvert or an extrovert?
Definitely more of an extrovert.
Okay. What if you could only eat one food for the rest of your life? What would it be? Calories don't count.
Pizza and ice cream. All day, every day. Super simple, but...
Okay, that's 2 foods, but we'll let it go.
Well, if I have to do it for the rest of my life, I need that touch of variety. It's like the perfect birthday food.
Yes, I agree. You're going to love going to kids' birthday parties as your kids get older.
That's awesome.
What's something most people don't know about you?
Ooh, I would say a lot of people don't know. Let's see. What do a lot of people not know about me? A lot of people don't know how much I've traveled in my life. I've actually been to several continents, over 20 countries. My husband and I, pre-kids, used to travel almost on a monthly basis out of the country. So I'm an avid traveler, pre-COVID.
Wow. Wow. That's amazing. I agree. I was a traveler pre-kids, not a new country every month. That's really ambitious and awesome. But one day we'll get back to some travel here.
Yeah,
Just maybe
some
not
sense
today.
of normalcy.
Um,
Exactly.
yeah. And finally, really important one here. Nail salon, hair salon, or spa. You can only pick one to visit for the rest of your life. Which one is it?
Spa all day, every day.
Yeah, got to get the massages in, right?
Yes, ma'am. I am a huge fan.
Awesome. Well, before we wrap up today's episode, Dr. Carolina, can you just let our listeners know where they can find you?
Oh, sure. Yeah. So I have a YouTube channel, Dr. Carolina Sueldo. I drop weekly episodes every Monday, and they're just little 10-minute snippets because I just don't have the attention span for longer. So I do little just 10-minute videos on different aspects surrounding fertility and hormones. And then I'm also on social. I'm on Instagram and Facebook. I definitely am more active on Instagram, also by my name, Dr. Carolina Sueldo. I would actually love, if your audience, after listening to this episode, I would love for them to DM me with questions or comments about our episode together.
Amazing. Yes, we will definitely have the links to find you in the show notes so you can access Dr. Carolina easily. And then, of course, let us know what you loved about this episode. Let us know if you have questions for Dr. Carolina. She'll be tagged in all the social media posts, so you can access her that way too. All right. Well, thank you so much for being a guest. I know I learned a ton. I'm sure our listeners learned a ton. I appreciate you being here.
Marissa, this has been super fun. Thank you so much for having me.
You've been listening to the Mama Work It podcast. I hope you've enjoyed this episode and would love if you could take a quick minute to leave me a review on whichever platform you're listening from, and maybe even send a note to a fellow mama friend recommending it. Reviews and recs help this podcast grow and reach more like-minded, awesome moms. And if you haven't subscribed yet, don't forget to click that button so we can stay in touch, girl. By the way, if you haven't checked out the Mama Work It website, please do. There are lots of free resources and great articles there that can help you with the juggle of work life, mom life, wife life, fill in the blank life. So head on over. Thanks again for being part of the tribe. I'll see you soon, but in the meantime, keep on working it, mama.